When COVID first arrived here in New York City, I don't think it was something that any of us had any concept of what we'd be engaging and encountering with. Certainly I didn't. Despite hearing about China, despite seeing things about what was going on in Italy, it just was too much to in any way understand on a personal level what it would mean for us and what we were going to experience. This is the space of 4 days of leaving and coming back. The change was incredible. It was only a few days later that they shut down all business, all non-essential activity, subways, schools, everything else. To walk through the city during that time was mind-blowing. There was no one out. There really was nobody in the streets. It was really incredible. I can't imagine what it was like for other places, not having the experience we have. It might be hard to get excited or concerned or understand the impact of what happened. But for us, in this course of 2 weeks, we filled up the hospital ×2. We had 3 times as many ICU patients as we have ICU beds. Every ICU was filled where there were 2 patients in every single room. We turned the lobby into a patient care area with full ability to support step down and ICU level care. We partnered with outside organizations to build an actual ICU in Central Park outside, which was full. A neurologist that I work with regularly died. A neurosurgeon that I know died. One of the radiologists that do our ultrasounds died, all within the space of a few weeks. So it was scary, and that caused us to do things that were maybe not necessary, but were important for us at that time. Many of us left our families for an extended period. I did. Our residents took part in COVID ICU care teams. But the interesting thing, and one of the special things about neurosurgery is we still take care of emergencies, right? Patients are still going to have ruptured aneurysms. Patients are still going to have strokes. Patients are still going to have, severe mass effect from brain tumors. And a lot of work had to go into how to figure out how to do that. We cover 8 hospitals across the Mount Sinai health system. And so we had to protect and secure one old ICU with 12 beds to become the designated neurologic emergency space for all 8 hospitals. So that's what it was like. It was not overstating it to say it was cataclysmic here. It was something I certainly don't want to ever go through again, but that on some level you feel like you've grown, and hopefully we're better doctors for
it. Especially March, April, May of 2020, as we were learning more and more about this virus and how easily it could be transmitted. We started having, instead of rounding as a team, having just one resident go to each patient room, because we didn't want somebody to get infected and infect the entire team, and then we would have basically nobody to take care of the patient. And so really some of it had to do just really with the trust, to make sure that everybody that rounded on each patient knew exactly that they were the ones that knew about this patient, and this is true also for faculty members, so that we would minimize the chances of one team member getting infected and then potentially infecting others. As you know, all the conferences became virtual, so all our conferences went on to Zoom. I was very skeptical how that was going to work initially, but it is really amazing. Within a couple of weeks, everybody had to figure it down pat. Actually, I'm finding now it's harder to get people back into regular conferences. Everybody still wants to be on Zoom. I do think that some of our chiefs, which were in 3 or 4 months of graduating, were probably the most severely affected, because they all of a sudden they did lose operative time, particularly in the last few months of their chief times, when they when they have the most refined skills and they want to apply the most refined skills. And those are the individuals I'm most worried about. Yeah, I think that in time of crisis, people pull together. And so, generally when there's not crisis, everybody has an opinion of how to do things best. But this was a time of crisis, and so everybody just set apart their differences, set apart their egos, set apart what they were concerned about personally, and we really pulled together to make this work. So I don't think there's going to be any long-term consequences to the training of our neurosurgeons, to the education of our resident neurosurgeons. And I think that when we look 10 years from now, at least for neurosurgery, it will be remember more is a time of courage, extraordinary compassion, and teamwork together, and perhaps even building teams and learning how to build teams more than a time of difficulties or a time that basically destroy your education.
Neurosurgical trainees are the lifeblood of neurosurgery. They're our future workforce. And so when we knew that COVID was coming, we knew that this was going to mandate a major change in the way that we do recruitment for residency. And we knew that we needed to make sure that safety and equity and education were all at the forefront of any policy that we came up with. We decided to go to virtual interviews really to make sure that we had equitable access for all of these students and applicants. That was something that was starting to be talked about by different governing bodies for medical students. But it was very clear that even though many of the students, many of us were already vaccinated at that time, that there were going to be different rules, different regulations for each medical school, each medical student. And so we had a town hall webinar. We all worked to use our collective wisdom and lack thereof to be able to figure out what are the best practices, what things really don't work. And we did some trial and error, but it was something that we came together nationally, every program chipping in to figure out how do we do this well. And then I think importantly, to really assess that. So we didn't leave it just as, oh good, this worked this time. We went ahead and we actually did a really granular survey of program directors, of program administrators, of applicants, and program leadership so that we could figure out what things worked, what should we repeat, what don't we want to repeat, what do we need to improve on. And that was some really important knowledge that came out of that, that's all going to be published. And that work is still ongoing. We made it through one really successful recruitment year. Everybody matched, everybody filled, I should say. And so we're excited about that. The work is definitely not over.
Yes, the Surgical Care Coalition came about as a result of cuts to the Medicare fee schedule that were due to be implemented due to revaluation of the evaluation and management CPT codes. The net result of those proposed changes would have resulted overall in a net 9% decrease in reimbursement to neurosurgeons across the country. And it wasn't just neurosurgery that was being affected, it was all of surgical specialties because of the revaluation of the evaluation and management codes did not translate to those services that were provided in the global surgical package. So the Surgical Care Coalition was formed by the American College of Surgeons, the Neurosurgery under our joint Washington committee with the AANS and the CNS took a real lead in that organization. And Katie Rico became a very effective spokesperson and very effective within that organization. That organization, the Surgical Care Coalition, was successful at delaying those cuts, which were due to be implemented at the height of the pandemic. You'll recall at that time, surgical practices had largely been shut down, and it would have been disastrous to have it implemented at that point. But the implementation was successfully delayed, but we're still fighting that battle today And the Surgical Care Coalition is still working on that, because those cuts were only delayed, they were not eliminated. And so surgical specialties are still facing a crisis in terms of their ability to deliver surgical specialty care to our seniors.
It generates a lot of pride in the kind of people that choose to go into neurosurgery. It's nice to be part of that group and be part of that team where when the chips are down, those people step up. And I think it's a fair characteristic to say neurosurgeons have. Next chapter in our history.
And now, more than ever, we know
we are stronger together.
We are stronger together.
We are stronger together.
we are stronger together.